Hi, my name is Dr. Sarah Rogers with Idaho Naturopathic Medicine, and it is my pleasure today to be speaking with Kurtis Simons of Naturopathic Medicine of Idaho, who also graduated from my alma mater of Southwest College of Naturopathic Medicine, which is now known as Sonoran University. He is a pediatric specialist as a naturopath, and I'm so glad he's here today. So, Kurtis, welcome.
Thank you. Thank you for having me.
You're welcome. So you are a Idaho native. You did what, as you know, I worked on the legislative work to get licensing, and you're one of the people that we wanted you to come back. You're an Idaho native, and you came back to practice here.
Yeah. I got in touch with Diana, the association, probably, I think it was in my second or third year at school, SCNM, and had always wanted to come back to Idaho, just because I felt like naturopathic medicine was so needed here. So I was super excited to be involved in the legislative process, and yeah, glad to finally be back and practicing and seeing the profession growing here.
Yeah, and we have all sorts of naturopaths that do all sorts of great work in Idaho. And you're at one of the levels where you went to a four-year federally accredited school and you did extra work in pediatrics.
Correct. Yeah. So during my clinical rotations, my fourth year at Southwest College, we had honors tracks. There was four different honors tracks. One of them was pediatrics. So and that was mentored by Dr. Matthew Barral. He's kind of one of the forerunners for pediatric naturopathic medicine. So yeah, I spent the last year of my schooling with Dr. Barral, got special preference for pediatric patients and pediatric conditions, and looking at research and all of those things for kids. So it was a really awesome experience. Really glad that I got to do that.
Yeah, Dr. Burrell is great. I got to work with him when he started at Southwest College. So
Yeah, that's
it was
crazy.
one of his off-site clinics. So I wanted to talk to you today because you not only see peds in your practice, but you do vaccine consults for parents. Can you tell me a little bit about that?
Sure. Yeah. So vaccine consults is, I think, kind of something that was born out of my own frustration as a parent. I have three kids, and it was just challenging to go to the doctor's office and you do your wellness exam, and it's like, these are the vaccines they need. What are we doing today?
Mm-hmm.
And we always had questions as parents, like, well, what about this vaccine or that vaccine? And there was never a time available for that in any sort of traditional pediatric wellness visit. So the vaccine consult really is a time for parents who have questions about vaccines, the diseases that they prevent, or additives, whatever it might be, anything about vaccination, to come and talk with me and ask those questions. We discuss in an open environment, and try and help them feel more confident in whatever decision they might make.
Right. And it sounds very patient-centered care, not like you have to do this or else.
Yeah, it's, like I said, very open environment. I feel my job as a physician, as a doctor, is a teacher. So teaching you, okay, about the diseases, if that's what you want to know, teaching you about the vaccines, how they work, because some vaccines work differently. Most of us understand that now, have a little bit more emphasis on vaccination in the last few years. So yeah, my job as a teacher, and to provide information and understanding so that parents can make an informed decision. That's a key point in any form of medicine, but especially in naturopathic medicine, is helping our patients understand what's going on
Right.
with their healthcare, so that they can make the best decisions for themselves, not me telling you, hey, this is what you should do, or vice versa.
Right. And that's the beauty of naturopathic medicine, is that we take the time to give patients all the questions they want to ask, they can ask, or the education so they understand why we do what we do.
Yeah, absolutely.
I think that's wonderful. So your consults last how long?
I schedule 45 minutes for those consults. And so I really try to encourage parents to focus on specific questions, because sometimes they can go longer if we get into the nitty-gritty of some of the history and, all of that. So I really try to encourage, okay, let's focus on what questions we need to address in order to help you make a decision, rather than ruminating on past history of politics or whatever it might be.
Right. And you do vaccines in your clinic, but you also provide them that information to be able to go get them in their other clinics or the health department, right?
Yeah, so definitely, whether you're an established patient of mine or you're just coming to me for a vaccine consult, I I'm happy whatever decision you make. If I do vaccines in my office, I am a cash pay practice. I have to pay for those vaccines. So there is a little bit more of an expense there for patients who choose to do that. And usually they can get reimbursed if they have insurance, but there is that factor that is involved in my particular practice, versus if you go to a traditional pediatric clinic, they will bill your insurance for those vaccines.
Terrific. And for those vaccine consults, do you do that just in person or do you do telehealth?
So far I've done them in person. I haven't had a huge demand for telehealth consults, but if that was to evolve, I'd definitely be happy to meet that need.
And you have a license in Idaho, so is it just Idaho or is there other states?
Just Idaho, yeah. I don't have any licenses in other states at this moment.
So the telehealth, my understanding, the telehealth law is that you're only allowed to do advisory consults for people who live in Idaho or physically in Idaho. So yeah, for those of you who are in Oregon, who want to do a visit with Dr. Simmons, you'd have to go see him directly.
That's correct.
Okay. Is there anything, is there any pediatric patient you won't see? You're seeing peds. Is there anything that you would advise them to see a medical doctor first, or do you see all types of peds?
I mean, I see all types of peds. Really, it depends. With pediatrics, it's either something that's very easily treated in the outpatient office, or it's an emergent case. From my experience, it's and so I don't have any particular patients that I turn away. Okay. I see them all.
Alrighty, and you are located in Boise, is that right?
Correct. Yeah, I'm off Eagle Road between Ustick and McMillan.
And then what is your phone number? And we're going to add this to the end as well, but if you want to give your phone number for your clinic so people can write it down now, that would be great.
Yeah, my office number is 208-391-5043.
Okay, and they can call and make an appointment either for their child as a pediatric visit or parents who want to talk about vaccines in general.
Yeah, absolutely. You can call to book, or you can also book online at my website, natmedidaho.com.
Not to be confused with mine, which is ID NatMed.
Right.
We are the naturopaths of Idaho.
Yeah.
I'm Idaho Naturopathic Medicine, and Dr. Kurtis is Naturopathic Medicine of Idaho. Not to be confused, even though we like each other very much.
Yes.
Okay, so do you have anything that you just want to add about your practice or general suggestions about vaccines or how you look at vaccines?
I don't think there's too much more to add. Like I said, I just really try to keep an open space here, so that parents who are looking for more information, who are looking for, and maybe one thing that I can add is that there are parents that do want to vaccinate, and that is totally acceptable. Like, I don't care either way, but if you are wanting to vaccinate, we can look at alternative or natural things that we can do to help support your child when they get vaccinated, to help buffer some of the effects of the aluminum or those excipients or adjuvants that might be in those vaccines. There are things that we can do to help buffer those. So that's maybe an additional thing that for parents who have already made their decision or whatever it might be, if they're looking for or a little bit more support as they move along their course, I'm also a great place for that.
Right. And do you look at if somebody has a family history of adverse effects to vaccines, do you have advice for like maybe their next child in terms of vaccines? You help them make that decision as well.
Yeah, I mean, that's always a tough, it's a tough case. We never know. And it's coming back to weighing the risks versus benefit. Are the risks really worth it or not? And it's very much an individualized case. If there was a significant family history, then we might weigh that pretty more heavily and decide not to do vaccinations or to do a limited amount of vaccinations. But
Right.
it's very much an individualized thing, as it should be. Any procedure or whatever it might be in medicine has to be informed consent with weighing the risks, benefits, alternatives, and moving forward from that point.
My hope is in the future, and maybe this is a pipe dream, is that we actually get a little genetic analysis done for each child, so that you can look at the methylation factors or the detoxification factors and the triggers, so that you would know specifically, individualized medicine, if a patient has higher risk for an adverse effect for a vaccine. Because we do know, as you mentioned, the aluminum, it's inflammatory, and some people just can't get rid of that stuff, or it easily triggers for whatever reason. And so my hope is that eventually we have real specific individualized medicine at an early age, so that we can determine who may not be a good candidate, so we don't have to work from the point of figuring out how to fix somebody after they've been hurt.
Right.
That's my hope.
Yeah, I think that hope is not too far off. Things like 23andMe, getting genetic analysis it's still a little bit expensive, but we think back like 15, 20 years to do something like 23andMe, just order a genetic test and get your results. That was not possible, but now very much so. So
there was a test. Genova Diagnostics had a test, but and they looked at the detoxification pathways, and that's only a minimal amount of what you get from 23andMe, and that was like $400 back then. And 23andMe is, for what you get, it's very affordable. And there's other ones out there as well, Genetic Genie and things like that.
Right.
We know a lot more. I'm just saying that it would be nice for insurance to like do a little analysis and recognize the fact that potentially people can be hurt, and that we can make have that higher level of informed decision at that point. That's my hope in the future.
Yeah, I hope so too. That would be fantastic.
We just need to have some smart genetic person out there develop a PEDS test.
Yeah, yes. That's always the struggle, is trying to get diagnostic tests with kids.
Right, exactly. Well, Dr. Kurtis Simons, thank you so much today. Is there anything else you had to add about what you do?
No, I don't think so. We've covered a lot of good ground, and I'm just excited to be here with you, excited to be in Idaho, and excited to be helping children and their parents make great decisions about their health.
Right. And I'm so glad you came back and started to practice in Boise. So, all right. Well, if anybody has any questions for Dr. Kurtis, you will be able to get his information at the end of this. And I hope this was a helpful little interview to know that there is a pediatric specialist of naturopathic medicine in Idaho now. So thank you so much for coming back.
Thank you.
All righty.